Hi, I'm Dr. Tim Pearce, Medical Director of SkinViva and SkinViva training here in Manchester. If you've had a Botox treatment and you leave it to run out, basically what happens is the little connections that are made between the nerve and the muscle are gradually rebuilt by your body, and the movement starts to come back. So it might help you a little bit to understand that if you understand more about how Botox actually works. So all the Botox actually does is basically find its way into the nerve terminals that usually cause a wrinkle to form by making the muscle contract. And all that it does is trim off just one receptor in your body, and that receptor is on the wall between the nerve and the muscle. And when that receptor's gone, Botox rapidly loses its effect. So the actual molecule itself, the actual botulinum toxin molecule, will disappear, but the effect is that the nerve no longer is able to cause the muscle to contract for as long as it takes for that little receptor to rebuild. So for an average treatment, after about 4 months, the movement starts to come back. So are there any long-term consequences of this process? Pretty much the answer to that is no. Most muscles will come back to their full strength within 4 to 6 months, and everything will be as it was before. The subtle exception to that is that when you treat a muscle, it tends to get a bit smaller as well. So if you've had treatment for many years, your muscles can be really small. And although they will still come back to full strength, some people have noticed very subtle changes in volume, which is obviously another sign of aging. And it can therefore be worth leaving occasionally, maybe once a year, a little bit longer between treatments so that the muscle bulk returns to normal, and then you can resume treating again after that. So long-term, no known long-term complications from treating with Botox, but a very subtle effect that you might notice as muscles get smaller.